Now, the Northwest Province has recorded over 980 new cases of COVID-19 in the past 24 hours, with the cumulative number of infections now sitting at over 102,000. Northwest Health MEC Madoda Sambatha joins me now for an update on the province's response to the COVID-19 pandemic. MEC, good evening, and thank you very much for your time tonight here on In Focus. Of course, reporting over 102,000 now cases. It was sitting at 101 yesterday, which means, of course, you are continuing to see a rise in those numbers. You are quoted as saying in one radio interview that you are concerned by the lack of compliance in the province. What is happening?
Thank you very much, and thank you to the listeners. In fact, you are correct. We are increasing on a daily basis. What you see as 900 today, it's an improvement downwards. But if you had seen the past week, we had been above 1,000. If you check, that's why we take this thing very serious. If you check the active cases in your dashboard, it's Gauteng, it's Western Cape and Northwest. Now, for the two provinces' population, I have no problem. But for a population of Northwest, once we have over 16,000 active cases, it tells you that one day you would wake up with no availability of bed space for those people, because you don't know who's going to get sick the next day and who's going to easily deteriorate to need hospital attention. So yes, it's true, it's growing, and it's a number that we're not happy of. But besides that, South Africans and Northwest people still overly rely on government and on policing instead of them taking charge of their health responsibilities.
Are the lockdown restrictions helping at all with the numbers in the province?
The COVID-19 restrictions in the province, you see, wherever you go, once you have a regulation on liquor, what it helps, and it has been scientifically proven, what it helps, it's reducing the number of people who are dominating hospitals over and above COVID, and therefore give you enough space for beds. But once you have COVID increasing to this level, even that space would still give pressure. Regulations, yes, only on the abuse of liquor and the impact it has in unnatural causes of hospitalization.
Yeah.
But beyond that, all other regulations are not adhered to by our people. And you will recall, in the past week, the Command Council took a resolution that we must move across the province and ensure that we monitor compliance. Up until when will South Africans only comply when they see government officials?
Yeah. How many people are vaccinated thus far, MEC?
Vaccination thus far is 162,565. This number is constituted by healthcare workers, constituted by education sector, constituted by elderly people 60 and above, and then it's now starting to be constituted by SAPS members. Remember, they also have started their vaccination very soon.
Yeah.
What you see is that the number is very high at 60 and above.
Yeah. There are some, though, who are concerned about the slow vaccine rollout, raising a doubt about the capacity of the health department there. Kurusrand, Siga, and is it Mobane and Kuma? Apparently, people there are not yet vaccinated. What's happening?
No, there's no area where vaccination has not gone. The only area is when you use Pfizer, dominantly you are going to have restriction in terms of vaccination sites. Remember, it has a stricter requirement compared to Johnson & Johnson, on cold chain management. But we only cover that even by doing outreach programs. So in an instance where Pfizer can't be stored in that area, we do an outreach, taking it just for jab directly and coming back. What you see in the vaccination in the province mirrors the national vaccination program. South Africa's vaccination, it's not compromised on the basis that health has no capacity to deliver. The main problem in our vaccination program is a gap between the demand and the supply. Predominantly, we've not yet received a time where, when we're targeting 2 million people, exactly we receive 2 million vaccines. Even on this one that we're talking about, you will know that each time we're a targeted population, we don't get vaccination equal to that population. So registered people have always been far above the available vaccines, and this is a matter of supply. In the province, it's almost like that. As I speak with you, even healthcare workers never received the number equal to them. Population of 60 and above never received that, but we're doing very well. What we are also encouraging people to do is that registration must be done irrespective of the vaccine. We remind people and do both vaccination on site. We want to improve accessibility so that vaccination does not become skewed to those areas that have access to sites. It also goes deeper to rural areas where sites might not be operational because of cold chain, but vaccination done directly there.
MEC, what do you make of the comments by the Premier about 5 days ago, where he says that the number of nurses testing positive for COVID-19 infections is on the rise in the province, but he says that this is due to their social lifestyles and not observing COVID-19 protocols?
This used to be the case. Since the vaccination of nurses and healthcare workers, the number of those that are testing positive has drastically dropped. What you have in the previous case is that the nurses that have been testing positive have not been testing positive in facilities, which meant that their contacts were people outside. Now, when the Premier says it means it's their social activities, most of them would have gone to a funeral. Most of them would have gone to a party. What we see in the province is that COVID-19 is not dominantly live in facilities. It is people movement wherever people are moving. So that's why reduction of movement and compliance to the red toolbox are the only ways that are going to assist us reduce. But as we speak and as we have started vaccination, we've not seen an increase, but it's a decline on healthcare workers testing positive, which also means vaccination has helped government approach to reduce transmission amongst healthcare workers as the only value we have to respond in the COVID-19.
Yeah. Now, I see your province's Twitter handle advertising some posts in the healthcare sector. Is there a shortage of healthcare workers?
Yes, there is. There is. It's becoming too much. Remember, currently we have a serious problem created by vaccination. On vaccination, we are using professional nurses as trained vaccinators. You take them from their original placements where they are normally working per shift. Now we have a problem. We're operating facilities as normal. Then you have vaccination, you have taken some staff. Then your increase of third wave has a demand of hospitalization. The same nurse you took yesterday and trained for vaccination is the same nurse that is needed now on the increase and hospitalization of third wave. What therefore that means is in between we do have a gap. So that's why we are advertising for healthcare workers to submit their qualifications in the provincial government so that we then balance between vaccination, normal running of facilities, and then response to COVID-19 whilst the third wave is still raging.
All right, that is the Health MEC there in the Northwest Province, Madoda Sambatha. Thank you very much for your time, MEC, and joining us tonight on In Focus. When we